Hello, everyone. Do you hear me?
If
Yes, I hear you. Hello, everyone.
hear you because you will be the first. Okay. And we will
Yes,
be
I'm there.
with briefings in a few minutes. So
Yes, I'm waiting.
for
I
the
hope that you
beginning,
hear.
you will share the screen, right?
Yes, no problem. I am in now and I will share my screen in a minute.
How do I make this thing project over here? Anyone have any idea?
Do you see my screen?
Yes, yes. You see your screen.
Excellent. So once you will start, please let me know so I can start my presentation.
Which jewelry? Which? There's a bunch of files over here. You just remove that and put within desktop.
Oh, wait, what do I do? Hmm. Should be here. Yeah. So what do I do? How do I?
Okay,
Yeah,
I'm
that's-
good. Is that
yeah.
the one?
Mhm. Mhm.
That's good.
Wonderful.
So that's on desktop.
Okay.
So once
Will this show your notes?
notes, as in the notes are at the bottom
Yeah.
over here.
Yeah.
Yeah, if you
Like what if you're in presentation?
yeah, if you're in a slideshow presentation. That's a different slide. Yeah, that's how it's going to show. Yeah, nobody. You don't need to. You don't even need the presentation. All right. I just need to figure out this piece. I have no clue how this works.
how this works.
Never taught in this classroom.
This?
Very good. Yeah.
That's okay. Nie musimy niczego zmieniać, tak? No. Czy nas słyszy? Nawet nas słyszy, mówi, że słyszy.
Yes, tak słyszę. Słyszę.
No dobrze, my zaczynamy teraz. Good morning, everybody. It's good that you can chat in the beginning already, but there would be a break that we can continue our chatting, but we want to be on the schedule. You see how lovely discussions are going on? There would be a lot of time. There would be coffee break, lunch break. You will have chance to chat, make plans for future events, and so on. I am Lydia Filus, chair of mathematics department, and our department originally started these modeling workshops in fall of 2012. And then after a while, we partnered with the Grand Chicago Czech And here is the person who runs those workshops already for a while with me. There is the contact PI from Chicago Czech, Professor Krystyna Ciecierski from economics. Krystyna, if you can invite.
Just welcome everyone to this morning's conference workshop. As you know, these take place twice a year. So this is our fall edition of the math modeling workshops. And what can I say? Chicago Czech is very happy to be working for so long now in cooperation with the math department here at Northeastern to be bringing these workshops to you. So thank you all for attending this morning.
And already think about the 25th modeling workshop that would be together with Women in Science and the Datathon. And maybe Krystyna, just a minute about that, if you can say.
So our Women in Science conference will take place in the month of March. And the dates that we have in mind are the March 3rd, 4th, and 5th. That's a Monday, Tuesday, and Wednesday. This year's conference is dedicated to the field of computer science. And so we will kick off the week with the math modeling workshops on Monday, and then transition into a datathon challenge that will be led by Dr. Hardik Marfadia, sitting at the back of the room here. And then Wednesday will be dedicated to our traditional Women in Science conference. It will be an all-day event. We will have interesting speakers, a career panel. So we invite you all to just mark your calendars, but there will be information coming out. The new t-shirts are already created and produced. So they're sitting in Cecilia's office. Cecilia is here somewhere. And we're looking forward to making those available to you any day now on our website, Center of Health at NEI.
Okay, and then usually we are introducing for greeting our guests, besides us who organize, people who are supporting this type of events. And here we have Ken Fogelsonger, who is Associate Dean in the College of Arts and Sciences, where both departments are located. That has a few words of greetings.
Hi, everybody. So thank you for the invitation to just provide a few brief words today to welcome you all. So on behalf of the College of Arts and Sciences and Interim Dean Tim Libretti, my pleasure to welcome you to the 24th Annual Mathematical Modeling Workshop at NEIU. So today we look forward to an engaging workshop on a number of topics, all related to interdisciplinary quantitative analysis. And it's great to see that we have presentations from,
Because otherwise
yes, you can't see me. Presentations from our students, colleagues from the SGH Warsaw School of Economics, Lake Forest College, as well as our own students and things, a presentation from our Student Center for Science Engagement today. So welcome to all of you. I hope you have a wonderful and exciting day. And just many thanks to the mathematics department for all the work they put in, as well as the Center of Health and Chicago Czech for all of the support that they've been giving and continue to give to this long running and important event that we have here at NEIU. And I just want to, again, wish you all a great day. I hope you have fun and get to meet some people and learn some new things. And again, just welcome to NEIU. And yeah, we're happy to have you here. So enjoy the day.
Thank you, Ken. And then another person who was almost from the beginning with us, I think. Marcelo, you were before at the first one, right? So Marcelo Steinberg, who is the Dean of College of Graduate Studies, Research and Analytics. Did I say correct or they changed? So you can correct me, okay?
College is graduate science and research, and my title has analytics somewhere. Good morning. It is right. Probably with more hair, but I was here or in a different room on the first one. Yes, so 2 things. I'm gonna be brief and I want to welcome everybody. I see my face here, but this is no good. I see my face, but the light was just on my eyes. Couple of things. First of all, I would say the same thing at the beginning, which is I commend everybody who's here on a Friday morning. It's true that the week Friday is the same as Monday, Wednesday, or whatever, but to come voluntarily to present or to listen or to learn, or the three of them together, it's great, especially when you're here early on. So kudos to your inquiry part of your heart that wants to continue learning and continue improving. And I hope you can continue through your entire life. The second thing I want to say is that isn't this, I know, I'm not going to talk about politics, but isn't this a wonderful time for mathematicians, statisticians, and mathematical modelers? When you turn the TV, probably by now we are tired, but when you turn the TV and start hearing about the model says this, the model says that, there's a 50% chance. Everybody now is an expert on predictions and things like that. And right or wrong, it's funny because this election, maybe I say it's a 50-50, and people say this is great. The 50-50 is like flipping a coin. There's nothing scientific on this. If you say that something is a 50-50, but people are talking about, back in the days, probably when you say, I like to study math or something, people will look at you as you are a nerd. You are talking about things that they are extraterrestrial. They are not common day-to-day things. I still remember in high school, people asking, some of my friends say, why are we learning this? When I'm going to apply it, all right? And now these days, people are not questioning that. Everybody's talking about how we model things and how we use this on our daily life. From medicines, from modeling pandemics, to seeing elections, or seeing how people feel about the economy, or things like that. So you are at the right spot, at the right time, hopefully studying something that will be very relevant for the rest of your life and for other people, which is important, not just for you. My last plug, since it's my job as well, right now as an interim dean of grad studies, is that as everything, studying is lifelong learning skills. So as you finish or you're closing to finish your degrees, keep an open mind. Keep an open mind. And it's not just you can study on your own. Of course, you would be welcome here. But if you want to continue, you can continue on a graduate education. After you graduate, you can go and get experience and think about getting a graduate education. These days, there are certificates. There are different things that keep you current. And if I know you're going to have a talk on modeling, and there's the data science coming up. Our fields, because it's not just one field, keep evolving. And the only way to stay connected is to stay learning, to become a lifelong learning. So use what you learn, get engaged, increase your passion, stay connected, and keep doing these things. The last three, and I'm leaving with this. Think about how many times you start something and say, I'm going to do this for the rest of my life. And then you say, well, I try to do it for next week. And then you say, I hope I can repeat it tomorrow. It's not easy to do something 24 times in a row and start thinking about the 25th one. And sometimes we take that for granted. So I want to use this, my last remarks, to thank Dr. Phillips and Dr. Chicierski. Where's Christina? Okay, what's here for? They are. They've been here from day one. And I know sometimes the job looks taxing and gets tiring, and they continue doing it. So let me say thank you again, but let me join you by thanking them for organizing this and staying with us all this time. I hope you enjoy the day.
Thank you, Marcelo. I also want to introduce the person, also from mathematics department, Dr. Emma Turian, who will be chairing today's workshop. We try to involve faculty. Some people are with us already on a line, because after pandemic and during pandemic, we were doing first online version and then hybrid continuum. But we need to make a very short break. You can start, Emma, but for connecting the first presenter that would be online, he's overseas, and we need to connect microphone to the computer. Harvey, yeah.
Do you hear me now?
We can hear you, but the room cannot hear you. I can,
Okay.
I'm here, but we need to.
So please let me know once you are ready so I can start.
Yes, Emma will do that. And
Great.
then good to see you, and
Good to see you.
it's good to know that you are continuing with us even after NAVA grant, and that your colleagues are at other conferences right now. We were hoping, right, that a group of students from Ecuador will be coming in person. That's why
Okay.
organized on this day that they could, but unfortunately they cannot, and
Mhm.
it will be
Okay. For me, it's a pleasure to be there, and I hope that I will represent SGH, Warsaw School of Economics, in the best way.
Yes, and we plan another collaboration, very likely around workshops. To
Okay. We are looking for, I don't know
already
if we will
progress
manage as of
to
March,
some people
as
and we'll be talking
Professor Cicierski announced as of March,
when
it
she
will be
will
tough,
decide.
but next year,
But
I
she
hope
will
that we
decide
can,
soon.
I hope that next year we can join you personally, face to
Okay.
face in November, maybe.
Yes. Which is already now, November, but she will be later, right? Karen? And I know we'll be discussing with Marzena about other grant opportunities and support for continuation of
I
model
think
work.
this does not come back.
Yeah. In the meantime, I
Restream.
just want to say that we will have a different type of presentations. We will have a presentation by a faculty from another university from Poland that we had a grant that was supporting this modeling workshop for several recent years. And we will have also presentations what Czech is doing or how develops regarding the managing with data, how to do with data science or how to apply data for in different areas. And we will have also presentation by Northeastern students. Northeastern students who did learn our language, how to model, and they want to share with us. We will have a presentation by an advisor from Student Center for Science Engagement that will be presenting, will be guiding students how to read a research paper. And we will be having a presentation also by Northeastern alumni, who is now a faculty member at Lake Forest. And she was graduating also with degrees from mathematics. So we have all the spectrum, right? We have collaborators, so could be like research collaborators, a little bit higher level, but then everybody can see where could be the area that what we are doing could be applied, what could be done with the grants that we are doing now and how, what impact they are having, what services are being provided to support research. We are student session, the students new group that it's called Spark, and they will be talking about this Spark, we need Spark, and there would be more what they wanted to provide for other students, how to read the research paper. And then so all variety and very diverse presenters. Okay, Emma, are we ready?
I hear you very well.
Okay. So I
Do you
was
hear me?
just trying to use the time, but if you want to use one short break. Okay.
David, can you hear us?
Yes, I hear you
David,
very well.
do you hear us?
Yes,
think
I
you can.
hear.
Yeah, okay.
Do you hear
We
me?
need to see whether we will be, it takes some time to be connected to microphone. I'm sorry for another one change for the rooms because we 102 and sound over there. We received this room, but after our intervention this morning, we are allowed to use
The other one.
the other one, and maybe there would be better to get connected over
Should
there.
we try that?
Yeah, yeah. because we didn't start yet. So David, it would be a little bit, and everybody who is online, a little bit of disturbance, but
Once you guys let me go, you go set up the other room
Mhm.
and then he'll go.
Okay.
How about that? And
yeah.
then, you
Yeah.
know,
Yeah, yeah.
so that,
Your
There's less-
presentation is already
yeah.
there.
Okay.
yeah. So we are changing rooms for a better one.
Okay.
But you see, did I tell you that you will have occasion to chat? So you can continue your chatting, but we are moving to the room across to the room BBH 102 that originally was. No.
And David, I'm gonna go ahead and do my short 15-minute presentation and then we're gonna go ahead and set up the other room and then you can go. Is that okay?
Yeah, I think that if we will, but what time do you think it's my turn?
See, it is almost, it's like 20 to, it's let's say 10 a.m. our time. I don't know what the conversion is.
Okay.
In about-
Okay. So I will stay online. So please let me know. Okay.
Okay, sounds good.
I
Oh,
think it's-
everybody's leaving anyway. No, I was just gonna go ahead and do my presentation while you guys set up the other room.
Oh.
Oh, okay,
We should be okay because we are having generous lunch break.
okay.
Yeah, so
Do we need to do anything here then, or?
no, you only need to disconnect or close it like that.
Let's wait until we have it connected.
Until you have connection over there, right?
We're on the move. We didn't tell you this is a mobile conference.
That's right. All right, this is great. And then, yeah, but the other is a lot nicer. You want to hear that? Yeah.
Yes. Guys, you are speaking because I cannot hear you now. Guys, you are connected because I cannot hear you. Do you hear me?
Yeah, we can hear you.
Great. Now, once you are using mic, it's fine. Yeah, you should be close to mic, and then that's fine. So please let me know if you are starting or should I share my screen?
Just one moment, David. Mhm. Okay, all the way through. Okay, let's do it. I'm gonna go ahead and, I know. Yes, he should go first. Yeah. David, can you hear us? David, can you hear us? David?
Yes, now I hear you. You should be close to your mic, to the mic.
Okay, so. Okay, so I am introducing the first speaker. His name is Dr. David Macerek from the Warsaw School of Economics, SGH. And the title of his talk is going to be Poland's healthcare system, a benchmark against EU models. So let's welcome Dr. David Macerek.
Okay. Hello, everyone. I hope that you hear me well, if you can confirm.
We can hear you well.
Great. I hope that you see my slides. So thank you for great. So thank you for a warm welcome. So it's a pleasure to be a representative of Warsaw School of Economics, SGH, and today I would like to tackle the topics of the comparison of the Poland healthcare system with a benchmark to EU systems. So the agenda of my speech, I will try to catch up because we are probably slightly run of time. So with introduction, then I would like to briefly discuss data and methods, results, and conclusion. So looking at the introduction and importance of the topic and research goals. So we know that the primary goal of any healthcare system, if it's in US or in Poland, in Europe, is to maximize health improvements. So the goal of the healthcare system should be targeted at higher life expectancy and better treatment outcomes. So that's the main goal of any healthcare system. Polish healthcare system, just to let you know, is managed by the Ministry of Health, and it's financed by a social health insurance. It's called National Health Fund in Poland, and Polish government is increasing public healthcare spending to 6% of the GDP. You may see this data as extremely low because in US you are spending like 15 or 20% on healthcare. In Poland, we are catching up 6% of the public spendings of healthcare. And one of the strategic investments are in primary care reform, so GPs, oncology networks, because we have a lot of new incidents of oncological of cancers, cardiology and rare diseases. That's the main goal of investments. And Polish healthcare system is facing a lot of challenges, but one of them is weak referral system from the outpatients clinic, non-hospitals, and hospital care. So we have the system which is very based in the hospitalization and based on hospital beds mainly. Yeah. And this work, this presentation will be aiming to compare Polish healthcare system to EU, European Union member states in terms of the spendings, quality, access, outcomes of and resource allocation. So looking at the data and methods, so primary, I use several data sets from Eurostat, WHO, World Health Organization, and so that's the main source of the data. Looking at the spendings, however, also not only public, but also private spendings on healthcare, looking at the number of health personnel, looking at the number of GP, number of hospital beds, and also self-reported unmet needs related to the long waiting list. As a result, also I compared healthy life expectancy at birth, Poland versus European Union countries. So the comparison of health sector, as I mentioned, Poland versus EU. However, within European Union, I distinguish two sub-regions. The first one is EU10, so all the countries entering EU before 2004, and EU13, European Union countries, 13 of them. Those countries enter EU after 2004, and Poland is also in this basket. So the analysis includes microeconomic data, public and private spendings, human and infrastructure resources, including the number of health personnel, GPs, and hospital beds, unmet need for healthcare, as I mentioned, and healthy life expectancy. So what are the results now, guys? That's the table. And as you see, as I mentioned, Poland, in terms of 27 European Union countries, then in this column, you may see EU15, and CE are the countries from the Central European Union from Polish, let's say, region, like Hungary, we have here Czech Republic, Slovakia, all of these countries in the Central East Europe. Post-Soviet countries, I will say, and EU15, the Western mainly Europe, like Spain, Germany, Belgium, Netherlands, you have in this basket. We have all of EU countries here and Poland. So looking at the public spending, as I mentioned, Poland is targeting 6%. The current spendings are 5.4%, according to the Eurostat. EU average 8%. If we compare to US, as I mentioned, is almost half of the spendings. And CE, our region, even Central Eastern Europe, only 6%. So as you see, Poland in this dimension, looking at the public spendings of healthcare, the amount of money allocating for healthcare is very, very low and is compensated, unfortunately, with the private spendings. Because if we look at the private spendings of the households, we see that almost of the 28% of the all healthcare expenditures is from the private side. See 25%, which is not so significant. However, Poland is leading in this dimension. If we look at the resources, human resources, if we look at the health personnel, we see that there is almost 240 health personnel per 100,000 inhabitants in Poland. But if we compare to the CEE, and unfortunately, if we compare to EU15, it's almost 50% lower number. So as you see, we are under-resourced in terms of the human resources in the healthcare system. If we look at the GP level, I will say the statistics are even more dramatic, because here we have 40 GP per 100,000 inhabitants, but looking at the C level, also it's lower. However, if we look at the EU15, it's almost 60% lower number. So as you see, number of GP on the Polish healthcare sector is extremely, extremely low. On the other hand side, as I mentioned, the Polish system is a very old one, because we are very rich in the hospital beds. So if we look at this statistics, more than 600 hospital beds per 100,000 inhabitants. If we compare to EU 15, it's a lower number. So as you see, we are very rich in this statistic. However, if we look at the self-reported unmet needs for healthcare due to long waiting list, almost 20%, 25% of the society reporting self-report unmet need because of queue of the waiting list. So in Poland, it's also very high number. As a result, we see that this is, let's say, one of the driver probably also of the shorter healthy life expectancy at birth. So at birth, we expect that each Polish citizen is living in the healthy life, I feel in the good quality of life, 68 years. It's very close to the CE average, even slightly above. However, Western European countries, 71 years. So it is 3 years gap in the healthy life expectancy. And one of those results are for sure financing, access to the medicine, however, also waiting times and not enough resources in the Polish healthcare system. So that's a snapshot of all the results. If you look at the country perspective, I would like to show you some statistics because it's also good to see where we are. If we look at the public spendings, as I show you, Poland here, the green bar, Czech Republic, Austria, Denmark, very high spendings in terms of the GDP on healthcare. If we look at the health personnel, we are at the lowest, the lowest level. Austria, Portugal, Spain, with very high number of health personnel. If we look at the hospital beds, we are in the top, I will say. If we look at GP, the lowest in the ranking, very high number of Portugal, Netherlands, Austria, France. So as you see here, huge differences between Poland and the other countries, unfortunately. Then I would like to show you a very simple analysis which I created. Here in this axis, you see healthy life expectancy at birth. Here is the EU average. So as EU average is close to 71 years old, healthy life expectancy. If we look at the self-reported unmet needs for healthcare, so how many percent of the society is reporting unmet need, the EU average is slightly below 20%. And here I created, based on those two dimensions, the averages from EU, 4 quadrants. In the first one, as you see, those are the countries with pretty high, one of the highest healthy life expectancy, above 71 years. But in the meantime, in those countries is also high self-reported unmet need, like Italy, France, we have in this cluster, or Italy. In the quadrant number 2, we have Poland here, Hungary, Lithuania, Latvia also here. We have shorter healthy life expectancy and also very high self-reported unmet need. And if we look at the quadrant number 3, in those countries, we have short healthy life expectancy and also not so high, not so many people reported unmet need to the healthcare due to long waiting list. So in this case, we can explain the shorter life expectancy maybe due to some lifestyle, like alcohol drinking, for example, in Czech Republic or in Bulgaria, Romania, very high smoking rates. So this quadrant is very lifestyle driven, I will say, with life expectancy. And the last but not least, but it's very, let's say, great place to live, I will say, because very high healthy life expectancy and pretty low unmet need for healthcare. So in this cluster, we have quadrant, we have group of countries like Cyprus, Spain, Malta, Netherlands. Those countries are characterized with high healthy life expectancy, with the good quality of life and very good access to healthcare. So what are the conclusions? So the long-term strategic vision for Poland system is to address for sure our resources correctly, but firstly improve spendings at least to 8%, which is EU average. Then focus on the general practitioners, GPs, to improve from 32 to at least 100 to catch up to EU average. Policy changes should also reallocate resources from the hospitals to outpatients clinic to balance spendings and improve patient access to healthcare, because as you see, we have a huge waiting list. So due to such transformation, to move some procedures like surgeons to outpatients, we can save time for have more patients entering the system. And as I mentioned, limited financing, long waiting times are a key barriers to better healthcare access, which is for sure contributing to the 3-year gap in healthy life expectancy between Poland and European Union average. Okay, guys, so thank you for attention. That's all from my side. And if you have any questions, please let me know.
Thank you, David, for your great talk, for a lot of information for us that you provided. So let's see if we have any questions. Anyone? Yes, go ahead.
I don't hear you, so if you can use a mic, I can hear you. Or Emma, you can translate to me.
Yeah, I can tell you. Go ahead. Can you say? How are unmet needs defined? How are unmet needs defined?
Yeah, so the question is very simple. So it's in Eurostat. The question is if you experience in the last 6 months any problem with access to the any healthcare personnel due to the long waiting list. So in Poland, for example, if you would like to go for I don't know, ophthalmologist or dermatologist, you need to go to the queue. Then the queue in Poland is at 1.5 years, like 18 months with the public setting. So this is the question asked by Eurostat to the citizens in all of the countries. If you experience any unmet need due to long waiting list in the last 6 months. So that's the question.
So the wait time was kind of left to the person you were surveying their interpretation. It wasn't defined as a certain number of days or weeks. I guess when I saw the analysis, it appeared that the wealthier countries felt like they had a higher unmet need or less unmet need. Maybe their expectations were different when they were answering the question. Like they expected to wait less time. Does that make sense?
Are they expected to wait less time?
Yeah,
in the other countries?
Yeah. It seems like
I mean, what do you know, David, about the other countries?
you're gonna have to repeat all of them.
It was a very good question, but do you know anything about the other countries? I mean, versus the Poland unmet needs?
Maybe what I'm saying is, when they responded to the survey, that their interpretation of what a long wait time meant might be different.
Oh,
based on
right.
what country they're from and expectations.
Right. So maybe the unmet needs are defined differently in different places. So their interpretation. Yeah, it's the defined.
Maybe I could wait a long time.
Maybe you will step in. And I can talk that, you know, the speaker can hear directly the question.
Yeah, so.
It's better if you can go and ask me the question via mic. But in the meantime, I heard what you refer. So this sample, I will say, is coming from the European Healthcare Survey. It's the biggest one. Every 4th year, it's almost 300,000 participants in this survey. And Eurostat is aggregating the data. So as to the robustness and accuracy of this data, because the sample is very big, I will say that they are quite robust. And I can fully agree that 25% of the Polish citizens, for example, experience long waiting lists. It's a normal stage in Poland now. So the question is about another European countries, because as you saw in my presentation, EU average was even 20%. So the problem exists in across European countries. It's not that Poland is like outstanding here because our difference is only 5 percentage point, because problem of access exists in many countries, yeah? But in our case, we are outstanding with this area.
So was this study, yeah, Yeah, was this study carried out in the same way at the same time, or was
The
it
same
like
because it's
studies
standardized.
at different
Yeah,
times?
because it's the same because it's the questionnaire by Eurostat, European Healthcare Interview
Just
Survey.
one-
It's not my study. The sample is coming from the Eurostat.
So it's just one company, the Eurostat, who conducted this.
Exactly.
Did he answer the question?
300,000 participants in the survey.
Okay, so Nancy.
I want to follow up on the last question. So can you hear me, David?
A little bit.
Okay, so Emma, you can repeat after me, okay? So is it possible that the inhabitants of a rich country might have less patience and say that their waiting time is too long as opposed to the inhabitants of a poorer country who might be more patient and expect long waiting times, so that it's possible that wealthier countries self-report a longer waiting time simply because they're impatient, or in part because they're impatient compared to other countries?
Yes, so I think that the incidence mainly of all the non-communicable diseases like cardiology, oncology, diabetes, it's like very similar between EU countries, yeah? Even with the cancer incidence, we have similar incidence versus the other countries in Europe, yeah? There is no significant differences in the new incidence of oncologic, of cancers, whatever, yeah? So in my view, the long waiting lists are firstly driven by the resources, human resources, but also even if you have better human resources, the question is how you optimize the patient pathway. So how you optimize how the patient is going through the system, if it is optimal usage, because in Poland, as I mentioned, due to a focus on the hospital beds, rather than outpatients clinic, we have a lot of like different cases, like the patient can need to stay 3 days at hospital because the health fund is paying better if the patient is staying 3 days rather than 1 day. It's like crazy because it's occupied, the hospital beds are occupied, which is artificial because normally procedure can be done in 1 day. So that's why a lot of changes should be done with the reform and changing of the organization, not only investments in the resources, because it's important to catch up and improve number of health personnel, but on the meantime, parallel, I will say optimization resources what we have, because looking at artificial intelligence implementation in radiology, imaging, etc., we can improve efficacy at the same point of time. So, and I think that implementation of some things like lean management optimization can be done in many countries in the similar way.
So, 2 more questions. Oh, we got, okay, let me go to you now.
I want to make a comment more so than a question, I think. So I agree with Dr. Engel, there's some kind of confounding factor in the public perception of unmet needs, possibly based on, I guess, cultural or societal expectations.
Did you hear that, David? Confounding factors because of the cultural. No,
Yeah, could you repeat, Emma?
Okay, so that there might be some confounding factors. You may want to come in here if you have a longer question, but be prepared for some confounding factors, which could be cultural interference or.
In terms of unmet need.
Yeah. So
I was just restating your question.
Thank you.
So, not my confounding factor.
You can say your name.
Hi, David.
Yeah.
Thank you.
Yeah, hello.
So I think I agree with Dr. Engel when she mentioned there might be confounding factors based on societal expectations, maybe based on wealth of a nation. But there's a hard number actually that you gave about unmet needs, and that's the number of GPs per 100,000. A number of general practitioners, right? Per 100,000. So that actually is directly related to long wait times and the unmet needs, that kind of stuff. So think that was it, yeah. I just want to mention that.
Yeah. It's for sure. Now I hear you very well. So I will follow up this. But in terms of the cultural dimension, it might be some impact. You are right. Also, it will be good to add. However, in the Eurostat survey, which I use in this analysis, there was no any cultural dimension.
Okay, so we have one more question from him.
Should I come up to the?
Yeah.
Hey, David. So I'm still kind of stuck on the question about unmet needs and kind of how subjective it feels to me. And let's say maybe it is influenced by the cultural expectations of the country that's being surveyed. If you remove that factor from your analysis, would that have changed your recommendations? Would that have affected the life expectancy or some of the outcomes you're driving?
Yeah, so you are referring, so if I will remove the unmet need, yeah, if it will change the results of my analysis, yeah?
Yeah.
Or no?
Yes, that's what I'm asking.
Yeah, so normally I was focusing as the primary focus on this, as I mentioned at the beginning, that the goal of each healthcare system is to reach long life of the society. Healthy life expectancy is a good measure if the system is working correctly. In US, for example, your healthy life expectancy is 65 years. So we are even lower than Poland. So it's the efficacy of the healthcare system, in my view. That's why one of the idea, you are right, might be to remove unmet need, because in fact you may have very good access, but you have very, let's say, poor lifestyle conditions, diet, alcohol, which is resulting in very low life expectancy. However, in this analysis, I am focusing, as I mentioned, about this life expectancy plus access, because access to medicines also is important, because good access to medicine may compensate some unhealthy lifestyle. So that's why in this case I use it. Probably in the future it will be good if we can expand the analysis with some lifestyle variables like alcohol consumption, sport activity, smoking rates, because it make let's say direct impact on the healthy life expectancy.
Yeah, that sounds interesting. I also think it'd be interesting to see like if they could break down the expectations on unmet needs by the consumer or the patient. So depending on what need was not met. So like, for example, a primary care visit, I'm okay to wait a little bit longer for that versus something more acute. That would be interesting too, if the data is available.
Mm-hmm.
Thank you.
Thank you.
And any more questions, or if you want in whatever way.
Any more questions?
Correspond, then you can provide.
You can contact me directly if you want. I will put my email on the chat, and I can also provide you a link to the data which I use and questionnaire if you want to see.
Oh, the future work, David, future work for you? Maybe some correlations like we were talking?
Yeah, so in our future work, we would like to see, because next year we are planning to look at the healthcare system more, even not looking such in the data, however, management, organization of the healthcare system, and comparing maybe Poland, EU, France, the countries, how the healthcare system is set up. Maybe not only with the data, however, maybe some qualitative surveys. That's our idea for the next year, and maybe it will give us some, let's say, such interviews may give us a good, let's say, input to our further research in this area to compare healthcare system from the organizational standpoint more.
Sounds interesting. Okay, thank you, David.
Thank you.
So let's thank our speaker one more time.
Thank you.
So next speaker is Dr. Joely Brinkman from Chicago, Czech, and from the NAU Center of Health. And she will talk about the impact of the Chicago Cancer Health Equity Collaborative, the Chicago Check U54 grant on Northeastern Illinois University student outcomes.
All right, thank you so much for inviting me to come and talk to you for a few minutes today. I am Dola Brinkman. I am the site director and center manager for Chicago Check and Center of Health here at NEIU. And what I want to talk to you about today is the impact that the Chicago Cancer Health Equity Collaborative, or this large U54 grant that we've had, has had on the students here at our university. So, so first of all, a little bit about the Chicago Cancer Health Equity Collaborative. We go by the name Chicago Check. As I mentioned, we're a large multi-million-dollar U54 grant, and that means we're a collaboration amongst Northeastern Illinois University, Northwestern University, and UIC. They're all our partners. Our mission with Chicago Check is really to reduce or hopefully eliminate health disparities in cancer across the city of Chicago. Okay, and we have many, many, many ways in which we attempt to do that, but I'm going to basically categorize them as community engagement. So we work with over 20 community partners throughout the city to provide education and resources about cancer care, treatments, prevention, and prevention. We also have an emphasis on research projects. So we fund multidisciplinary research projects that attempt to answer questions, attempt to solve problems having to do with health disparities in cancer. And then the last thing that I'm going to focus on is our educational component. And this is where our students come in. So part of the reason why I want to focus on our students today is we have just renewed our grant. So we've had this grant since 2015. We just put in our renewal for our next 5 years of funding. And in the process of doing that, we, together with Susan Ryan on our team, had put together a large report about the impact of this. And today we're just going to talk about the student aspect. Okay. Going back to my other slide, I missed one really, really important thing that Chicago Check is trying to do, which is that it wants to increase the research capacity at NEIU. Okay, so what does building research capacity mean, and why is that important for a school like ours? Well, it's important for a school like ours because, well, what it means is increasing the ability to conduct and engage in research activities, okay? So why are research activities important? Research is a really great recruiting tool. It enhances the reputation and profile of the school. It brings in money and prestige to the school. It promotes collaboration amongst faculty, students, staff, and other institutions. And it helps to prepare, importantly, students like our students for careers and further study, graduate study. It also helps to keep the university community updated on research issues and innovations. Okay, so one of the ways, and I'm not going to go into it too much because I think Dr. Jaturski is going to talk a lot about this. One of the ways that we have tried to increase the research capacity here at NEIU is by building the Center of Health. So the NEIU Center of Health was launched in 2020, and our mission is to promote the ongoing pursuit, lifestyle, and advancement of health by engaging, motivating, challenging, and celebrating the health victories of our students, faculty, and staff. Now, what that translates to is a lot of different initiatives that, again, I'm not going to go too far into. I'm just going to stick to the student initiatives that we have in that regard. So what we're looking at is we now have kind of a smorgasbord of opportunities for students. We have some opportunities that are born from the Chicago Czech Grant itself. And those opportunities include our Chicago Czech Fellows program, our LEAP program, our Senior Fellow program, and students having an opportunity to be research assistants on Chicago Czech research projects. Now, conversely, through the NEIU Student of Health, we offer a health crew intern placement program. We offer Women in Science Conference and of course, math modeling conferences, workshops, which is a way to engage with students. And we also provide, but again, I'm not going to talk too much about statistical services through the REST Corps, summer data camps, data funds, and Excel workshops. Okay. So this is just an overall view of all the students that we've sort of touched since 2015. I know it's kind of a complicated chart. There's a lot of different numbers here, but some of the important things are we've had a total of 141 students that have been touched in Czech in some way. So we've had 43 students who were Czech fellows. We have had 40 students who have worked on a Czech research project. We've had 8 students return as senior fellows. We've had 14 students do an internship through our crew program. We've had 13 LEAP students. And then also, you know, there have been some one-off where we have paid for research assistance to our Czech faculty, or also at times we have sponsored student research through the Student Center for Science and Engagement. Another thing I want to just point out about this is all of these students and all these activities have created 187 presentations that the students were involved in and 11 publications that the students were involved in. Okay, so more about our 141 students, okay? 40% of them have been underrepresented minorities, with 20% being Hispanic, 14% being Black, 12% being Asian, and about 26% being white. And a majority of our students have actually been female, with 68%, and male, 31%. So where do the students come from? What students are interested in joining us here at Czech? And it's a little surprising when you look at the different majors that we have. We get students, a lot of students, of course, from social science and that are studying health related careers. We get students from math, interdisciplinary studies. But a majority, about 40%, do come from the basic science department. So biology, chemistry, physics, but also surprisingly, the next largest population of students we get are those from computer science. And I think as Dr. Tchairsky had mentioned earlier, we are having our annual Women in Science Conference coming up March 3rd, 4th, and 5th this year. And our focus this year is going to be computer science. So it's kind of a nice marriage of how those things could all come together. Okay. Let's look at just the status of, okay, so in that 141 number, we also have some graduate students mixed in that came from the crew program where we place MPH students, and I'll talk more about that. But this chart right here is just looking at the undergraduate students. So we're looking at, you know, the status of these students. So what we have is we have 83 have graduated. 2 have not graduated or continued in school. And then we have 23 students that are currently enrolled. So what this means is that we actually have a really high graduation rate. I mean, students who get involved with Czech and kind of stay involved with Czech and the Czech family have a really, really good tendency to graduate, which is great news. Also, just pointing out here again, you can see the spectrum of degrees of students that join our programs. We have economics students, English students, geography, psychology, Spanish, you know. But again, we do have a lot of students from biology and again, computer science. Okay, so this chart is just showing, you know, of the students that have gone on, have graduated and gone on, this just shows the highest degree obtained by our students, okay? So A majority of our students, about 45, have a bachelor's degree. And then you could see that several of them have gone on to get a master's of science, master's of public health, and we even have a couple of doctorate degrees thrown in there. Okay. I think this is kind of interesting because this just sort of shows where our students receive their graduate or professional degrees. So a lot of our students from Northeastern are, of course, from Chicago, and not surprisingly, they branch out to other schools in Chicago. There's a couple deviations of some students going to U of I in Urbana or Southern Illinois University. But interestingly, almost half of the students stay at Northeastern and get their master's, which I think is really nice. It's like they kind of stay in the families and they stay, with the school to further their education. Okay, so now this chart is just looking at where currently enrolled students who are in graduate or professional programs, what they're doing or what they're enrolled in. So we have here, we have a lot of people seeking a master's degree in molecular and cellular biology, mathematics, computer science. Again, really, really big one. And we have some students who are doing their doctorate in physical therapy, pharmacy, osteopathy, dentistry, or law. And then we also have several students who are working on their PhD in the more specialized biological sciences like neurobiology or molecular medicine or molecular and cellular developmental biology. So now I'm going to switch gears a little bit and I'm going to get more specific about the first part of the chart I showed you in the beginning, where we are talking about Chicago Check and the Chicago Check offerings that we've had since 2016. It all starts with our Cadillac program, which is the Chicago Check Fellows program. So the Check Fellows program is an 8-week-long paid summer health disparities boot camp. It is open to undergraduate students from Northeastern, Northwestern, UIC, and the community colleges of Chicago. So our cohort is really, really diverse in terms of different thoughts and majors and things. Some of the program highlights include the students attending lectures at Northwestern and UIC and, with experts there and at Northeastern. Doing workshops that are professional development or training workshops like Excel workshops or data camps. They participate in journal clubs. They do site visits to our community partners. They participate in peer mentoring and they get together as a cohort and do a final group project. So we've had a great response to this program. And as I mentioned, 43 since 2016, when the program started, 43 of our Northeastern students have gone through the Check Fellows program. So after you enter the Check family as a Check Fellow, you then have the option to do what's called the LEAD program. And the LEAD program is our companion program. In the LEAD program, the students they'll connect with a mentor, somebody that they want to work with in the laboratory or in the community or just about anybody they meet during the program that they connect with and can work with. And Chicago Check will sponsor them to do that work with that person for a semester, which is also renewable for a second semester. I'll talk a little bit more about the LEAD cohort, but so far we've had about 13 LEAD students from Northeastern. Another thing they can do after they've been a Check Fellow is they can come back and act as a peer coach to the next generation of Check Fellows as a senior fellow. So they actually come back, they help us run the program. It's great kind of skill building and confidence building and job skill building experience for them. Before I leave the Fellows program, I just want to say we are recruiting and our application is now open. So if you're looking for a really, really fantastic mind expanding internship, please feel free to take some flyers I left on the table over there and ask us any questions if you have questions about applying. Okay. So now I just want to take a little closer look at the LEAP students I talked about. Those are the students that get the one-on-one mentored experience, working in a laboratory, working in a research project, working with the community. So like I mentioned, so far we've had 13 of them. And you can see here on this chart, this is the cohort year. But once they're a Chicago Check Fellow, they can come back anytime and do a LEAP. You don't have to do it in the same year that you were Check. So this just shows, you know, their undergraduate major, kind of where they're coming from, what their career path was, what they were interested in doing with their career at the time, who their mentor was. And one thing I want to point out about this is because Chicago Check is a collaborative with Northwestern and UIC, our students get a chance to work at UIC and Northwestern, so that it's not unheard of for example, this student working with a mentor at UIC, or this student working with a mentor at Northwestern. And then another thing I want to point out is we have about an equal split here of projects that are basic science laboratory projects, and then other ones that are more community focused, like this student who did community engaged research on oral cancers with a dentist at UIC. Last thing I want to point out is some of our outcomes from this. So you can see that some of these students have actually gotten, you know, presentations. They've gone to meetings and presented their data from doing this program, and some of them have even been involved in manuscripts from participating in the LEAP program. Okay. Now I want to talk back about our Check Fellows, and I just want to say, you know, what are their outcomes? Where do they end up? Where do they go? Where are they now? So again, starting from 43, we still have 13 students who are completing or currently working on their undergraduate degree. Okay, we have 10 students who are in graduate or professional school. We have 8 students who are currently working in some form of research. We have 4 students who are actively working in healthcare. And we have 3 students who have gone on to work in like health administration or education, kind of like doing my type of job. And we also have 3 that are in completely unrelated majors, non-medical, non-cancer, non-research focused. And then we had 2 on which we were unable to, fortunately, collect any data. Okay, now I want to switch over to the Center of Health and talk a little bit about, you know, the Center of Health that we've established here at Northeastern, some of our student offerings, and what that translates to, what that looks like. So one thing is, Dr. Tuturfi established the CREW. And the CREW is a student internship placement program that provides an opportunity for NEIU students to get involved in real life health experiences on campus and within the community. Their internships, they usually last for 1 semester. They're unpaid, but they complete program requirements. And typically what this ends up being, we get a lot of MPH graduate students who do the CREW for their required internship, and also a couple community health undergraduate students. So we've actually had 12 MPH students that we placed and 2 community health undergraduate students that have worked with us. And some of the past places that we've placed them include the Department of Economics, the Swedish Hospital in a program they had called the Health Equity Zone, the Black Cancer Collaborative, the Research and Statistical Services Unit in the Center of Health, and also with some of our Chicago Check ongoing research projects. If you're, and of course, there's a link there, or you can use your phone and look at the website for more information on that program. Okay. And then the next thing is, you know, we had talked about the fact that the Center of Health does a lot of sponsored events, this being one of them, of course, but also we do Excel workshops, we do summer data camps, we do data-thons, we do women in science conferences. And importantly, the Center of Health can provide an electronic skill badge that you can actually add to your LinkedIn profile for potential employers to know that you actually earn that skill by attending that workshop. So this is a lot of data. I'm not going to go through it all. But actually, this is data just since 2022. The Women in Science program has been running since 2017, but this just represents since 2022. And you can see, like based on all these activities, we've engaged almost 500 students in this programming just in the last 2 years. And then again, I'm not going to talk too much about the Research and Statistical Services Unit because I know Dr. Chichersky is going to speak about it right after this. But just real quickly, what that is it provides free guidance and statistical support for faculty, staff, and students here at Northeastern, and sometimes outside entities too. But a majority has been, of customers has been at Northeastern. So I just wanted to show you this quickly. We do get a bunch of different types of requests for data. Some that might involve putting together a grant proposal or just general research. But we also get them from students in terms of doing their homework or thesis project. And in fact, in terms of who has requested students in the past, we have quite a few undergraduate and graduate students that are currently using the REST services or have in the past. Okay. That is about all the data that I have to present. Again, I'm going to try and plug the Tech Fellows program. Our application is open. It is a really, really great program. I mean, people get so much out of the program that they never even knew they needed. Again, here's a copy of our flyer. You can, if you want to apply, the final application deadline is February 5th. What you need to apply is complete an online application. You need a copy of your transcripts and you need 2 letters of recommendation. The program this year runs from June 9th to August 1st. And that's about it. And please take a flyer if you're interested. Okay, and thank you for your attention.
So, pages. Students can earn badge for your session.
You can also earn badges for this, for this session and David's session, I guess, and all the sessions today.
So we got questions.
Yeah, I have a question. So, thinking about talking to my students about the internship program, what is the background expectation for the training that your students have? So, for example, my students in Math 173, college algebra, who are either science majors or going to be science majors, they may be freshmen. Like, what are you looking for in a successful applicant for the program?
The thing we look the most for is interest and desire to want to, make a change as far as health disparities. That's the single most impressive quality to us when we're interviewing students. Is really having the passion. And to tell you the truth, I mean, we really haven't, even though we're mixing students from different schools, we really haven't had any kind of challenge like that where we're like, oh, well, these students are more geared towards this and these students are more geared towards that. We haven't really had a problem with that across different majors even. So, I mean, I think the one thing, and I think our students are actually pretty well prepared for the data camps that we have sometimes our fellows join. So, yeah, so who are your students?
They're STEM majors, and they're going to be biology, computer science, chemistry. I'm trying to get some more math.
Would you like me to come by and talk to them?
I would think that might be good, but yeah.
One more question?
Oh, sure.
Just a comment, you can correct me if I'm wrong, but I think students can also come to the SCSC to get help with their application. So I'm one of the advisors, and if they want someone to read their application, give them feedback and help them put together the materials, like resume, CV, anything like that. That's what I do. So
thank you. That'd be awesome. Because I'm I'm teaching almost entirely freshmen in this class, so they're still figuring it all out. Yeah, so.
This is a really good program for that. I mean, we've actually, in the past, we had a student, she did really, really well. She ended up doing leave. She ended up, being with our Czech family for a long time. And she started out as an econ student. And she actually changed her major to biology. And now she's I think she's in graduate school for so not to say there's anything. That's your excellent in biology. Thank you.
Okay, so let's think again, Dr. Jody Bingman. Information, very, very important information. And our next speaker is Dr. Kristina Czekirski from Northeastern. She's from the economics department and she's a PI for the Chicago Czech. And she's going to talk about developing statistics, analytics, and data science resources in the research center for health at Northeastern Illinois University. Okay, so let's welcome Dr. Czekirski.
Get my orientation. Thank you.
Emma, can you send that, what the code is for the badges for the virus? Code for badges. Which should I put it on it? I didn't touch Hey guys, until we bring everything that we need on the screen, let's have a 10 minutes coffee break, okay? Is that okay? 10 minutes coffee break. Let you know when we can start. Yeah, that sounds good. So my but we can get it more. Yeah, if you can't get in, I'm here all day. Oh, yeah. I can find it. Yeah, because I know.
If you go to the website, you'll see the rates.
No, I just see. Do I just, I don't use it. Do I just migrate it?
It just renews the life of everybody. Well, it's actually good.
Oh. Oh, it's just a moment, it's just a show.
Yeah.
So. I have to say, buy
Oh, very. Yeah. Yeah, I'm just gonna. I think four. I'll be back a little bit.
Yeah, I know. I just wanted to make finish lines. It's always. I just. You think. But I can't. Or you can learn to laugh. No.
Yeah.
Option for it. Yeah. They only. They only. Maybe some. It's gonna be.
Yeah.
Okay. If you use.
Yeah. I will say. You know. And I can do that.
I know exactly. This is something you need to do.
Hello, everyone. We're starting our session, so let's welcome Dr. GSP. I'm going. Well, 45.
start?
Yeah, we can start.
Okay. Good morning, everyone. My name is Christina Tchaikovsky, as Emma has said. I am a professor of economics here at Northeastern, and also along with Dr. Lydia Psirios, we are the co-PIs and PIs of the Chicago Czech program here at NEIU. And before I go into my presentation, I just wanted to announce the code words, or actually give you the QR codes for today's badge, digital badge that Jolie mentioned. We're here for the first session. This is your QR code. And then for the second session, this is the QR code for the second session. And now with my session, we will begin the third session. And so as I remember, Lydia, correct me if I'm wrong, I'm not sure you made all the executive decisions. How many sessions must be attended to get the badge? 3, okay. So after this session, you should be good to go to start to qualify for the math modeling badge. Sure. It's not going to. It's not going to function. That one is not function. This is one. When I do slideshow, it goes up. Do you know someone? Oh, how'd you do that? Oh, you did extend. Okay, well, good. Thank you. Sorry. Sorry, technology. All right, everyone. So I'm here to speak briefly, I won't speak long, about our REST services here at Northeastern. So you might be wondering what the REST is. Jolie referred to it a few times. The REST is the Research and Statistical Services Unit through the Center of Health. So I'd like to begin just by clarifying a little bit further where we're coming from. So the rest is funded by Chicago Czech. So Chicago Czech is this tri-institutional entity that brings together Northeastern Illinois University, UIC, and Northwestern. When it comes to UIC and Northwestern, we work very closely with their medical campuses. So when we're talking about Northwestern, we're not so much talking about the Evanston location, but more about the hospital and the complex of hospitals downtown. So we're working with those cancer centers. And Northeastern, of course, doesn't have a hospital or even a clinical site. And so about 5 years into Chicago Czech, we're now celebrating our 10th year, we established the Center of Health. And Jolie already mentioned that the Center of Health has a number of missions and goals, but mostly we're here to just promote healthy lifestyle, healthy living, and also research and health culture here on our campus. And so the Center of Health seeks to pursue, advance, live, and share good health across not just our campuses, but across students, faculty, staff, and our surrounding community. So we have 3 missions: training and education, health equity, and then statistics and research. And so we have these 3 guiding pillars that have been guiding us now for about 5 years. And as Jolie mentioned, we have a number of programs that we've been rolling out as the years have passed. And the crew is something that Jolie talked about, and we welcome you to check out our website. The crew is basically an internship placement program, as Jolie said. And we've had about 14 applicants, and we continue to, entertain new applications. We've actually had applications come in from even the outside of Northeastern, but our priority is always to place our students first. And so I know there's some MPH students in the room. We look forward to helping you place into an internship for the spring term. We've been working on an ADHD component, and we've been trying to apply for grants, and we're getting closer and closer and better at that. And we're really hoping that we can roll out a full ADA Achieves program. If you look at our website, we do offer some virtual study halls, especially around exam time, final exams. So feel free to reach out to us about that. But we're very excited, and you'll hear more about the Spark in just a moment. Under the horizon, we've started to work with a group of students. Sana and Hiba are with us here, a brand new group of students, and we'll talk more about that in a second. But every year, the Horizon also is a co-sponsor of the Women in Science conference. And then most of all, what we're very focused on is our statistics and research pillar. Primarily because, as Jolie mentioned at the beginning of her presentation, we are now looking at our next 5 years of existence, Chicago Check or Check 3.0. We just submitted our refunding application. We really hope that it goes well, and that on September 1st, we will begin the third edition of Chicago Check on campus. And what that means is that Chicago Check 3.0 is going to have a very strong focus on statistics, not only at Northeastern, but really across the partnership. And that is to support statistical research, biostats, and even AI, EI focus. Oh, I see someone's trying to enter our room. AI components for everything we do. And let's see where I am in my presentation. But in all of that, we have Dr. Marfadia in the back. He will be leading a lot of those efforts. Dr. Marfadia is a professor in the Department of Economics and a close colleague of mine and Media's. And so we're really looking forward to Check 3.0, where a lot of that math, computational math and analytics is going to come to NEIU, but on behalf of the entire Chicago Check partnership, which is a huge challenge for NEIU, but we feel that we're really up to that challenge, and we'll be bringing that that funding, but also that capacity here to NEIU. So backing up just a little bit, I do want to accentuate the fact that these badges, the badges that you're applying for right now, have been with us for a very long time, because now we're on our third year of offering these digital badges. And please look for any of our programming, because almost everything we do, whether it's the math modeling workshops, the datathons, the summer data camps, and even Women in Science itself comes with a badge. And again, you can attach that to your Indeed or your LinkedIn profile, and help it tell a story a little bit about what it is that you've been participating in here on our campus during your undergraduate years or graduate years. So back to the rest. The rest is here to help you with any of your research needs where numbers are concerned. Maybe it's because you have a project that you have to design and it has to be survey-based. We would be happy to meet with you and design that survey even before you start your research. Or maybe you have a survey data that you collected a semester or two ago, but now the time has come to actually analyze that data. We're here to help you take that survey data, clean it up, advise on how to clean it up, and then draw results from that data set. Maybe you have data that needs to be merged with an outside data set. Or maybe you're just looking for a really good data set that you don't have in your hands just yet, but you would like some guidance as to, I'd like to analyze this and this topic, and where do I find data that would really help me find answers to my research questions. We're here to help you across that spectrum anywhere from data collection through cleaning, analytical exploration, all the way through analysis and even presentation. So feel free to find us. We just recently announced, or you saw a targeted announcement for our services. Basically, the way you get started with us is you visit our website or go back to that targeted announcement that came out last week. But we have an inquiry form that we absolutely require all of our interested parties to complete. That comes directly to our inboxes, myself, Dr. Pilos, Dr. Marfadia, and Lauren in the back. And we, within 24 hours to 48 hours, will be in touch with you about scheduling a consultation. And then meeting with you as soon as possible, and then helping you with your research design or research analysis. So please don't be shy. The service is free of charge, especially to all of our students and faculty and staff. I must say that we are, though, hoping to, with time, commercialize this service and bring it to the outside community. And bring it for all of those of you who are going to continue on to graduate school and medical school. We're really hoping that we can become a resource for residency programs and graduate programs that fall outside of NEIU. So in light of that, please know that you are a fortunate group by being still within the NEIU community and within our network, because we're willing to provide as much time and resources as we can to help you through your projects without any fee attached. So please remember about that and use us to the maximum. So that's our rest services, but out of the rest come all of these programs. The summer data camp and the datathon, which is what I want to talk about first, because that's coming up first in the lineup. So I mentioned at the beginning that the datathon will take place on March 3rd and 4th in the spring semester. I encourage you to start thinking about your team already. As we start to announce the competition in early January or mid-January, please look at our website. Please pay attention to sort of the directions or the prerequisites for the datathon. But I encourage you to start thinking about just the right group of individuals. We encourage teams of 3. And the way that the datathon works is we provide some introductory workshops, and Dr. Marfadia will be providing that. And then after those workshops that are designed to kind of equip you with just the right skills, we transition into what we call hack time, and you will have time to work with your partner either on campus, or feel free to go back to one of your labs at home or a lab in your department perhaps, and maybe work all throughout the night, order pizza. But you have time for about 24 hours to make something of the data set and of the guidance that we give you. And then in day 2, each team takes the stage, makes a formal presentation, and there are lucrative prizes for each of the participants. I can't remember what the numbers were last year, but I think Hardik, you might remember what was it was $300 per team member for the first winning prize, $200 per winning team member on the second winning team, and then $100 per team member for the third, the team that placed in 3rd place. So we try to incentivize you with some financial rewards, but also it's a wonderful thing to put on your resume, on your CV, to say that you were part of this team effort, and then have the badge on your LinkedIn page to sort of just stamp your accomplishments. So please be on the lookout for that. And then after the datathon in the summer, we're very anxious and excited to be offering the summer data camp. Believe it or not, but last summer we had 60 people in the B building lab taking part in our 3-day summer data camp. The data camp has a little bit different focus than the datathon, and that is we offer longer sessions for 3 or 4 hours, 3 days in a row, of some coaching and some hands-on testing of various specifications, whether in Excel or R. This year, we might actually try to make the summer data camp focus almost entirely on R, and perhaps provide some preparatory Excel workshops before the summer data camp begins. But be prepared to spend 3 days on campus preparing, learning, interacting with the peer guides that will be in the room, as well as with Dr. Marpadia and myself. And then the hack time is a bit of a different, there is no hack time, there's more relaxed, there's a more relaxed tone to the summer data camp, because you have approximately 3 to 4 weeks to build out a project and build out a presentation, a printed presentation, which then we present or will be presented at a jamboree, a research jamboree, where we have all the posters on display. And you have 2 hours to present your poster to all the interested parties that attend that jamboree. Then we break for lunch. The judges do what they need to do. And again, there are going to be prizes at the end of that. So again, you work in teams of 3, and we award $300 per winner in the first place prize, $200 for the second place prize, and $100 each for the third place prize. Yes, Nancy. It's for everyone. We've had actually graduate students participate in the summer data camp in the past. Yes, and you can mix and mingle, correct? Hardy, we allow undergrads and grads to mix and mingle on the teams. So this is what the summer data camp looked like this past summer, just to give you an idea. Last summer, please note, we started very early on June 11th. We probably will start a little bit later in the month of June this time around, just because our Czech fellows will also be involved. But pretty much the same setup will occur, so please plan ahead. And again, think about that team of 3. The better the team, as you know, the better the teamwork, the better the outcome, the better the output. I also have one kind request. If there's anybody in the room who hasn't yet registered for today's math modeling workshops, we ask that you please scan this code and just register so we know who you are. Part of what made Jolie's presentation possible just before me is that we are very obsessed as statisticians, many of us, with gathering data about the people that we serve on campus. It's very important, because when we go back to the administration and, I don't know, ask money for lunch or ask for money for prizes, ask for money for research assistant stipends, it's very important that we be able to tell them how many of you were here this morning and how many people are interested in what we do. So please do complete that. And then finally, this is the QR code for the rest. So again, you'll find the inquiry form there. Visit us. You can learn more about us there. Email us, fill out an inquiry form. Even if you're not sure what it is that you need help with, we're happy to meet with you and just introduce ourselves and help you take that first step in developing as a statistical and as a statistician and as an analytical researcher. Any questions? All right, thank you very much.
Thank you.
Yes. Okay, so let me just give you that badge now. I've got to close this down. Sorry, I'm not used to using 2 screens. Okay. So now this is the check-in QR code for this session that just passed.
Do the first video again, I missed it.
Sure. QR code is for 10 out. Okay, well then I will get that to you, so I have to check my email. I'll give them to you right after this next session.
So can we? So our next session is a Spark session by Sena Kusar-Habia, Hiba Salman, Spark, and Luke Devereaux from CSE. That's. We have a group in here, right?
First, you should go first. You can let me think about Spark because it's our new baby. It's awesome. Yeah.
Hi, Sana. My name is Eva Salma. We both are MPH graduate and we recently opened a journal club named Spark and we both are co-president and co-founder of Spark. The purpose of this club is to bring help in for the students who want to do research. The idea came when we were in our MPH and we were having struggle finding out the articles, correct articles for our courses. So I thought like we both thought to make some club where we can help all the students from different disciplines to help them how to find the proper research paper and how to go more into research. That's the basic idea of the research of this club. Then we met Dr. Steve from Center of Health and Luke from SCSC and we collaborated. They are our club advisor too. So we created this club for the help of the students. So we can like as a group we can learn about more about research. Yeah. So when we get to know at NEIU there were no journal clubs. So that idea came from there. So it's just starting. It's been 2 months right now, and we are going to plan more workshops next semester. So our partners are this NEIU Center of Health and the SCSC Center, the NEIU SCSC department. So yeah, so you all are welcome to join us this club and like we can develop like yeah you can bring your ideas because even we are new and your ideas are most welcome. Thank you.
Yeah. So hi everyone. I'm Luke Devereaux. I am one of the STEM advisors at the SCSC. I feel obligated every time I meet with students just ask if everyone knows what the SCSC is. So the Student Center for Science Engagement. If you raise your hand if you know about it. Okay. Pretty much everybody. So that's fantastic. It's just upstairs and we offer a lot of services to students who are studying STEM and are interested in research or getting help with any sort of application. So internship applications or graduate school, career planning, all sorts of stuff. So that's my obligated spiel about the SCSC. Plug this in. Okay. Awesome. Okay, so today I'm going to be talking to you about how to read a research paper. I have a big stack of research papers from all sorts of STEM disciplines that we'll look through later, but I'll start with some introductions. This is a little cartoon that I think kind of sums up what I felt like when I was reading research papers as an undergraduate student. For some background, I studied biology as an undergrad. And then I did 4 years in the PhD program studying molecular biology, researching RNA. And I realized research and science is really exciting and I love it, but I want to work with students. So I exited that program and that kind of brings me to today. So I did spend a lot of time reading research papers throughout 8 years of higher education. And this is kind of how I felt about it. No, if you make the paper too easy to read, everyone will know how you got the results. Has anyone felt that way when looking at a research paper? Yeah. It turns out that some people actually feel this, like that's what they're doing when they write their research papers. I've talked to really upper level faculty members who feel this way when they read research papers. And I would go to journal clubs with my advisors and it's like, yeah, this paper's bad. It's one word for it. Because it's written poorly and you're not able to understand it. And the point of writing a paper is to be able to communicate your science to other people so they can understand it. So if you're not understanding it, it's not always your fault. And I think that's a really good place to start with when you're a student learning how to read research papers, If you start blaming yourself for every word you don't know, every sentence that doesn't make sense, or figure that is confusing, you're not going to really get anywhere. So let's start from that place and then move forward with the learning. So to start, what is a research paper? Sometimes if you just ask students like, oh, bring me a research paper, you'll get things that are, like a Wikipedia article or a review paper or like literature reviews and stuff like that. They're not necessarily research papers. And we can discuss what those are. They're all, they all have their purpose in science communication. But today we're going to be talking about specifically journal articles. So these are primary research, science that has been done by the person writing the paper, that is peer reviewed and published in a reputable journal. So over here we have the Journal of Science, and they have this kind of subjournal, Science Signaling, and it's one of the most reputable journals that people know of, kind of on par with like Nature, huge journal. And then we get into more discipline-specific journals, which are what I brought in today for us. So it will include original data, that's what makes it a primary research paper, and author interpretations. A lot of the stuff we're going to do today when we break out and discuss these papers are discuss what the author is interpreting and then what we are interpreting from the results that are presented. Scientists, some people, we believe strongly in data, we love data. The data doesn't always speak for itself, it has to be interpreted, and different people can interpret it in different ways. And it's good to see sometimes if you disagree or agree with how someone is presenting the data to you. And I have some examples of that later on. So the general sections of a research paper, if you're unfamiliar, are an abstract, which is like the summary, introduction, results, conclusions and discussion, materials and methods, and then references. So as we go through these papers today, we're going to go section by section and do a couple of quick exercises for how to approach each section. We obviously can't, in the time we have, fully understand everything that's written in these articles. And that's something that's true for all levels of scientists, from undergraduate student up to ancient PI that should have retired. Maybe that's true. But it takes a long time to understand this dense amount of material. So we're not going to understand all of it today, but we're going to learn some approaches to how to maybe go home and understand it fully on the second, the third, the fourth read. So here are two examples of ways that you can approach reading a research paper. The thesis of this slide is that you don't have to read it in the order that it's presented to you. And most people actually don't. Here are two examples of how people can read a research paper, but these may not be the ways you want to read a research paper. So how it comes down to it is personal preference. And then also I think your experience will heavily influence how you should approach a research paper. So again, these are examples. These aren't how you have to do it. It's just ways that might be helpful. And just to let you know that people are doing it in different ways, depending on who they are. So coming from low background knowledge on the subject, people often will read the abstract first to figure out, is this worth my time and energy? And then the introduction, because you don't have all the background knowledge, you need that introduction. So from the introduction, you're trying to learn what's the problem at hand, what are we studying? Then maybe it could be helpful to even jump to the discussion to see how did the authors interpret what they did, how are they summarizing it, what did they find, to prep your mind for how you're going to approach looking at the more complicated parts of the research paper, which would be the results, so what's the evidence. Again, is the evidence supporting what the authors have said are the conclusions? Those conclusions might not be infallible. Often going back to the abstract can be helpful because people put in the abstract what they consider the most important takeaways. So you can say, does the abstract make sense to me now? On the first read, it probably did not, because it included a lot of jargon or other words or things that it didn't have background information for. And then finally, the citations, which provide really fantastic further reading. And again, we're going to expand on all of these sections. It's just an example. Higher background knowledge is a way you might approach it. Abstract first, overview. Also, again, is this worth my time? Is this on the subject I'm interested in reading about? Results. Maybe you've been studying this for 20 years, you know all the methods, you've read, all the background papers, you've written a literature review on this subject. So you jump to the results to interpret the data, coming to your own interpretations, going to the discussion, seeing if you agree with the authors, materials and methods. Maybe there's something to implement in your lab. Maybe they did something new that you want to approach your scientific problem with. And then citations, checking, do you recognize them in citation? That could be fun once you start to recognize people or people that you've read before. And then are there any that you don't recognize? Because as you get to these upper levels of science, you start to become the expert in your very niche part of the field. And it's good to be able to recognize all these names because it means you're up to date with everything that people are publishing on the subject that you study. So these are incredibly different, the ways that people approach things and the order that you read it in. I say, get it all in whatever order works for you. Make sure you're analyzing it with your own prejudices in mind and also understanding that the data is something that you need to interpret. But do not feel like you have to, start at the abstract and stop because suddenly you don't know half the words and you think it's going to be too hard. That being said, and I debated for a long time how to do this workshop. Today we will go from the front to back, just because we need to be synced up as a group when we're reading this. So we will start with the abstract and abstract, introduction, results, and go forward. So that kind of sounds like hypocritical, but that is what I came up with for today. But when you go home, you can read it any order. Okay, so let's start with distributing stuff. So you might have to change your seats because we're going to group by what paper you want to be reading. And I'll read out the titles. I have 5, and they're kind of spread around in terms of discipline. So I'll read all the titles, and then we'll figure out grouping and everything. Sorry to make you move, but it's happening. So first, in the Journal of Cell, which is my favorite journal. You might hear about that later if I remember. Gut microbiome and metabolic profiling and Framingham Heart study reveals cholesterol metabolites bacteria. I think this would be great for biologists, for chemists, biochemists, anybody like that. So if that is you, you want to come grab this paper, you can, but you can wait till I read all of them. The next one is psychology, investigating the genetic basis of altruism, the role of COMT, and then the name of a gene, polymorphism. So if you're interested in psychology, I have this one. This one is public health, sleep quality and associated factors among individuals with and without diabetes. That one. And you can choose outside of your discipline. There's no rules. The next one is computer science, an error-written real-time multilingual numeral string recognition system using deep convolution neural networks. So neural networks studying like when people have to write in the air in front of computers. So computer science. The next one, more topical, I think, is mathematical modeling. But in the application of plant science, so modeling temperature-dependent dynamics of single and mixed infections in a plant virus. This one does, I think, involve a lot of calculations and calculus, but is also about how plants can basically catch a fever when they're infected with the virus. So an interdisciplinary kind of mathematical modeling problem. Okay. Do people want to come up and grab papers? Do they want me to, should I walk out to you? What will get you the most involved in this? Okay, yep. Come on up. And you probably will have to share. So figure out who is in your groups and maybe sit together. When you're up here, I recommend grabbing some highlighters. They apparently have scents. Do with that what you will.
Sometimes they Google it, sometimes they just need to
Right, yeah. Oh, yeah. Well, it's also. Yeah.
I think so.
They've also been probably controlled.
I do put on the step in, yeah. No, yeah, I think.
Oh, yeah, that can be here. Yeah.
And if you want to put it on.
Oh, that's it.
But you can go with.
Everything else is yes. Yes. Yes.
Okay, does everyone have a group or?
Who else
copies along that has a paper? Psychology. Psychology.
Yeah.
Yeah, I'll make sure. Psychology. Is anyone lost? Raise your hand if you're lost. Biology. Get biology. Raise your hand if you have the cell paper, which is on biology.
So it will like automatically.
You do?
Right,
Okay.
once you do the
Here's this, and then you.
Yeah, so like. Because I can
If you want, you can grab your highlighter. Smell.
So with the step. I thought. It's really good.
This is it, I like to be extra mathematical model papers, like. Today, it's a mathematical modeling workshop. Okay.
Analysis, correlation, correction.
For everyone on Zoom, I recommend that you follow along with the slides, but you open another tab and you choose your own paper from the internet. One great place is PubMed, I think it's .org, and as well as a simple Google search can bring you to several places that have free papers online on whatever subjects that you're interested in. Or you can take notes on the slides and then go back to the paper. So for everyone on Zoom, I recommend that tactic. Sorry that I walk around so much. Okay, let's bring it back, everyone. So we're gonna start with the abstract, which is what I said you probably shouldn't do. But you all showed the papers based on a general interest in the topic, so that means that you are gonna use the abstract to say like, well, I think this is worth my time. Okay. So a general review of what the abstract will do is summarize the paper, in the manner that this figure is showing you. And for the main findings, basically like, why is this a big deal? In the abstract, they're trying to tell you this is the biggest deal that has ever happened in the history of science. Emphasizing the significance, but they're also leaving out things that are critical, such as background information for people that might not be experts in the field. They're trying to get you to understand what they think was important, but they're not using this space, this very limited space to tell you all the details. So let's do a little exercise. There we go. So this is the exercise that we're gonna do with the abstract, and these exercises, I don't want to run, we're running late, so I am gonna cut a lot of the time for exercises short, but these are recommendations for how to approach each section. So keep in mind, these bullet points, we may not have, the full time today to understand everything in the paper. So when you're reading an abstract, we're gonna take what we know about the purpose of an abstract and highlight the main questions the research is aiming to answer. Specifically, what gap in the field was present? If there was no gap in the field, if we knew everything, we wouldn't be here, we wouldn't be studying, there would be no more scientists, we'd be done, right? So we have to present a gap in the field in order to justify our research and the money spent on it especially. So what gap in the field is present? And then highlight the key finding, whatever they found, the most important detail. Be very conservative with your highlighting. It may seem like everything is important, but we want just kind of like 2 sentences that really focus us onto these questions. And I'll give you maybe like 5 minutes, and then we're gonna come back and you're actually going to tell me what you believe the answers to these 2 questions were. I have the SCSC prize box here. So if you speak, you get a prize. I think it's something pretty fun. So prepare yourselves. And let's take 5 minutes and focus on these questions. If you have any questions of yourself, you can raise your hand. There's also faculty here who might be able to help you as well. I can come around and help. I probably will. So go ahead, go off. Awesome. What was the key finding? Phylogenetically, yeah. Oscillobacter is a bacteria, I think. Awesome. Good job.
She's abstract. She'll teach yeah, no, I know. I know her. You know what everything.
That I think is a fine. Nature.
Yeah. I was thinking for and I hope you're gonna stay later.
But in a sentence of more.
Yeah, right.
I was thinking of you when I tweaked it. I was seeing something like that.
As you.
Yeah. Oh, I see. Okay. Wait, let's see, a couple more seconds. Checking with your group members.
Yeah, it's like super common.
Does anyone on the Zoom want to share a paper that they might have chosen while everyone else is finishing up their discussions? Okay, let's bring it back. Right, so review, we're trying to figure out just, this is our first approach to the paper, so we're not doing much. But what is the gap in the field, if someone was like, why should I have given them $5 million to spend 5 years doing this? There's 3 grad students that went home and cried. Like, why did any of that happen? They're gonna tell us, well, there was this huge gap in the field and it was really important to answer it. And then the key finding, we're gonna send those grad students who, they're refreshed now, they relaxed, they've got some sleep. They're gonna go present their key finding at a conference. Everyone's gonna be impressed. They're gonna get a postdoc position. What was that key finding? Okay, so which group wants to go first? Does anyone have a gap in the field that they think was really critical that they can, I'm thinking like one sentence really. Yeah, go ahead, Sana.
So in my paper was inequality associated patterns among nations with their character. So I think there are two gaps. Like in the demographic variables, the Asian person is 65 years old. I think it should be because there is diabetes in population aggravation in this and in some young population. The other gap was there is no connection of physical activity and sleep. So if we correlate sleep and physical activity, I think the results might change.
Are you jumping ahead and talking about gaps you think the paper left us with? Okay, that's fantastic. And we're gonna do that later. We're thinking, so if you were the author, like what gap on your mind? Why do this research if you're the author? Yeah. But for the sake of time, we'll just move around. That was a great answer for a different question. And I'll come back to it. Okay, who wants to go next? Just maybe one more group? Yeah, go ahead. Cool. And because we're going to discuss findings in more detail, we're going to skip this, but I hope all of you found the key finding. It's usually pretty much the last sentence or the second to last sentence in an abstract. Okay, so because we're just going, page 1 to page 20, 30, 50, we're going to go down to the introduction. So the purpose of the introduction explains the background information that you need to know in order to understand the findings. And also, so kind of the goal of the authors is that you understand the significance of what they did. It introduces new terminology. It emphasizes the significance rate and that presents the rationale for the author's approach. So the author needs to get you on board, and they need you to, be on your way to understanding the results. So they're going to explain why their approach is going to fill in that gap in the field that we just identified. Little flow chart, kind of, we're just hitting the key terms, how they relate to each other, and all that kind of stuff. But there's a lot of stuff that, when you read an introduction to a paper and you're not an expert in the field and you haven't read 50 of the same kind of paper, and if you go to graduate school, often you'll find yourself, you pick your subject and you have to do a qualifying exam or some sort of thesis or, any sort of process in which you pretty much review as much literature on one tiny subject as you can. So you're going to start to see the same terms pop up in the introduction. You're going to start to understand them, and their papers are going to cite each other and all that sort of stuff. But for now, it's often confusing because there'll be words that you don't know that they don't actually explain to you because they're writing to their fellow scientists at their level. So the exercise and the way to approach introductions, look up the words you don't know. I love Google. I think Google is great as long as you check who is saying the answer that you found and make sure that you believe them and you think they have the expertise to know what the correct answer is, Google's fine. Check if there are any nearby citations. So you probably don't have time for this. This is more if you're like at home on your laptop. But if there's any nearby citations, sometimes they'll be like, transcription factor, such and such, turns on XYZ gene. And then they'll cite it. And you're like, well, I don't know this transcription factor. I don't know what it does. I don't know what this gene does, what its purpose is in the cell or something. But that citation, that little like 11 that's above that sentence, right after the period, that can take you to a paper where they proved that these things are happening. And in a weird, meandering, kind of like spider webbing way, you can find your answer to all these definitions for these words or explanations for things you didn't know. And then a review paper, often called like a literature review, is a paper that summarizes the state of the field as we know it at that time. And there's a lot of really interesting, cool things about review papers, but their usability when it comes to learning a new subject, it's like the most advanced level of a textbook you can get because it's typically more up to date than a textbook. It's much shorter than a textbook, and it's on one very niche subject. So if you search unknown terms review paper, you might get something cool. And it helps you with a lot of what you need to know. Like, if you're studying your papers on diabetes and sleep disturbances, you could look up like type 1 diabetes review paper and scroll to the highlight or subheading that is what you need to know, things like that. So what we're doing are identifying the major questions, and we've already started on this, right? We looked at the gap in the field. What is the larger significance of the scientific problem? So that could be significance to society as a whole, significance to that field of research, significance to other fields of research, impact on science, impact on the public, on our understanding of this concept. And then I always love to make a bulleted list of key facts that help me understand a paper. And if you find yourself kind of rewriting the paper in your notes, you're going too far. So take a step back. Think about how you would teach this subject to someone. So I know you just got this paper. You're not prepared to teach this paper to a class. But if you had to make a slide that had a couple bulleted points on the key background information, what would it be? And how can you make it the most accessible to yourself and to the hypothetical other person that you're helping with this? But that person is also just yourself. So this is our exercise. Let's take another 5 minutes. I don't think we'll get through all of this in 5 minutes, of course, but let's see how it goes and come back with feedback, concerns, questions, and maybe a summary of what your group did. Okay, so go. So, but we're all reading. So what is your like computer science?
Material.
If you want to join the reading,
You really could research.
mathematics modeling, we're on Google reputation is just like how things are doing
And you're using the video for like the landing things, like a lambda or something. There's one that's in AI, I think. Yeah. I like barely look at it. I just saw someone using it.
Are you talking to them back there? I think they're on the same page.
Yeah.
Are you a computer science student or did you just grab the phone? Okay.
It's, what do you call it? It's like anyone, they call it.
So it's like the actual.
You can make it highlight some words that you don't know.
Okay.
And like note to your future self, like, oh, this. Sometimes when I'm doing the first pass of the paper, that's what I do is instead of focusing on what I do know, I highlight what I don't.
Yeah.
Yeah. Knowing what you don't know is important.
Yeah.
Underlining, highlighting, circling, all sorts of stuff just to, for me, it's like consolidating. Oh, well, it's not that I don't understand the full section, it's that I don't know these 5 words.
Yeah.
Things like that.
Put the pieces of the puzzle together.
Exactly, yeah. Yeah, let's do like 30 more seconds. I know we're not getting anywhere near through the whole section, but just identifying some tactics that work and some that don't, and then let's share.
It's like an API that can be used with my it's completely separate software. Yeah. So I'll be doing YouTube work too, with using like really like it was like I think programming from like it's very excellent.
Yeah.
Okay, let's bring it back. Yeah, anyone tell me something that didn't work when they were approaching the introduction? No one was lost. Wow. A room of geniuses. Okay, what works best? Let's go for that. Let's be really positive. All of you are definitely way more positive than me. What worked best?
Skim reading.
Skim reading. Okay, yeah. What did you skip over when you skimmed?
Like, we know the topic we are reading, and I was skimming like what is necessary to answer these questions.
Yeah, great. You're like highlighting, but with your brain. Yeah. Yes, go ahead.
So this is I did work, but in the introduction of this paper, they go through so much very different backgrounds into research on altruism. They pull out neuroscience, psychology, women's studies, genetics, the background of the individual, and I was getting kind of lost.
Yeah, who could be an expert on all of that across every field? Yeah. That's something to consider when you look at how they're analyzing their results. Also, Google is a great friend when you're like, who are these authors? Because if they're citing neurobiologists, geneticists, behavioralists, psychologists, all of this, but who are they? What is their background? Where are they coming from? I think that will become clear in their writing, but also just Googling their names is a quick way to find out. And that's helpful because if you're reading a paper on a subject that you're really interested in because you're studying it from like a biochemical perspective, and the title seems like it's the best paper ever, right? It answers your question, but you start reading it and you're like, this doesn't make sense to me. And you find out it's because these aren't biochemists. These are like, cell biologists, which that seems like a small difference. It could be a very big difference. So yeah, that's a great thing to consider. Okay. Also, don't forget to get your prizes if you've talked or have significantly bothered you during the day, you can also get a prize, which might be all of you. I think something that came up with someone I was talking to was that potentially focusing on what you don't know instead of what you do know can be helpful, because if you read a paragraph and you're like, well, none of that made sense, that's going to be really overwhelming and you'll stop. You might. But if you circle, the 5 words in that paragraph that just like make no sense to anybody who doesn't already know them, you realize, okay, it's 5 words. It's not the whole paragraph. It's not the logic. It's those 5 words. Okay, so let's keep it moving. Now we're getting to the results section. So maybe you have some pretty graphs. Maybe you've already seen some graphs in your paper. The results present some research findings in both figure and text form. This is a good time to know like what kind of learner you are. If you are more of like a very visual, like graphic person, the figures might make more sense, and then you read it in the text and you're like, okay, what the hell is that? For some people, they have to read the text in order to understand the figure. Kind of intermediate to that, reading the figure caption, getting the key details. But you might run into some, in the figure caption, they're not defining any words. They're throwing out every acronym they've ever come up with. So keep that in mind. But the figure captions do clarify with what each graph shows, and we'll get into that. And then the text will cite a specific graph and then explain the experiment that led to those results. Scientists, when we're writing these papers, have this a very particular thing, and I think you might have come across it if you have taken a class where you have to write a lab report, where it's like in the results section, you never say anything that has any opinion in it, right? It's just data. What did you do? What did you find? And then in the discussion comes in the opinion or the interpretation. So the text will explain the experiment and how they got the result, but it might not say what the result means. So that leads us to either have to conclude for ourselves what we think it means, or get to the discussion and see what the authors think it means. And ideally, we do both of those. So it's the exercise, which I think really should be titled the approach. So as you read again, underline words you don't know. I don't know why I went back. I was like, that's really repetitive. Okay, this is a shorter exercise. Highlight the main questions the research is aiming to answer. This is really repetitive. I've asked this of you about 3 or 4 times. And that's because in research papers, we want to stay really focused when we're reading every piece of information. We want to connect everything to the larger question at hand. We can't get lost, swimming in these smaller details. We want to analyze them. We want to see how they fit into the puzzle, but we can never disconnect them from the actual question or the context in which they were gotten from, which would be the experiment in most of these. So what gap in the field was, did I go back again? Yes. Okay. This is a brand new clicker, so. Okay, there we go. Okay, so here's the first thing I said, I stand by it. And also create a diagram or flowchart mapping each experiment to explain how the data were collected. If someone just shows you a graph and they don't tell you how the data were collected, which we actually had some fantastic questions during one of the earlier presentations about, so like, how happy are you with your healthcare was kind of the question on the survey. And that leads to a lot of sub questions of like, well, what's influencing that answer? Like, what is happening? Like, we're not asking how many days until you saw the doctor. We're just asking like, did you not like that waiting time? So these are the kind of questions that are important and why learning about the context and how the data were collected is really important. Identify the axis of your graph and what they represent. This is, this seems really simple. We all made Foxy Whisper plots and maybe middle school, right? But the graphs that you're starting to see in research papers are way more complicated. Sometimes they're genuinely overcomplicated. And many times I've talked to my PhD advisor, I'd be like, well, I don't understand this graph from this paper. Like, I understand their findings, I understand their conclusions, but this one graph is haunting my dreams at night. And she'd be like, yeah, I don't really get it either. Like, I'm looking at it and it's kind of confusing. So that's genuine possibilities that the graph is just, but start with the axis, keep it simple, don't get overwhelmed. Determine your main conclusion after interpreting the graph. So all of you sitting in this room, you are students. You are also scientists. You're studying science or something related to science. that makes you a scientist. So you get to draw your own conclusions after looking at the data. I think we also we learn a lot about critical thinking and society at large from people who draw their own conclusions once assessing the landscape of data and evidence on certain topics, and people who don't do that and just kind of go with other people's interpretation. So draw your own conclusions, use your own brilliant minds, and then determine something interesting that authors might not have mentioned. So we're not gonna have time to be this in depth, but a lot of times there'll be parts of a figure or a graph that aren't discussed in the text, and you're like, well, okay, but this is interesting. There's a trend that's not even brought up. That's not a mistake. That's not, you're not the only person to notice that probably. And that's also how people figure out what they're going to study next. It's well, we have this data, we interpret the parts we can. Well, there's this other trend, we don't know what this means. And if any of you become scientists who are driving your own research, it's important to don't quiet your mind when you find these questions, because that's how you write your next grant. That's how you start your next project. Is that you say, well, that didn't make sense. So what am I going to do about it? So when you're reading, keep in mind if something's weird, write it down and say that's weird, and come back to it when you have the energy and figure out maybe what could be done about it. So again, let's do 5 minutes. Maybe let's all choose one figure from the paper, anyone that you want, and have some sort of diagram or flowchart, just mapping the experiment or the way they collected the data. How did they go from getting the data to presenting the data to you? And show that, and it can just be words connected by lines, descriptions. It could be all the boxes and the arrows. It could be, if you're in biology, it could be little pictorials of what you're actually reading, anything like that, whatever works for you. And you can probably draw it on the margins or on the back of the article. And then determine more main conclusion from that figure after drawing your own diagram of how they got the data. Or do your best to get towards these answers. Okay, let's go. There's a bag for the trash. Oh, really? I have this fire. I don't do this. I'll just check in with her and say like, maybe we should keep it going, like, you know, someone feel like standing. Yeah. Yeah, so. It's kind of collaborative. That's such that you know. Oh, so. Yeah. Yes.
Adorable.
Okay, let's bring it back. Let's bring it back. Okay, does anyone have a figure that they drew or a flow chart or an explanation of the experiment that they want to share or get input on, or somebody's gonna have to do it. So well, we need one volunteer. And you got a prize. Does anyone want to do it verbally or maybe up on the board, you know, spur of the moment, see what happens? It's a hard topic, right? Figuring out how they did their experiment just based on, you know, their summary of it and not their lab notebook or something like that. Yeah, 100.
All right, I've tried to challenge a little bit this paper, but there is some certain terminology that I don't know. So they can make it a little bit difficult to interpret the data. So in that kind of scenario, I would focus more on the text than the graph.
Okay, yeah.
Because the graph, the text will give you like an extra information to understand what's going on with these variables that I don't understand.
Yeah, totally. Yeah, all the, you know, the acronyms and the graphs and the figures and no explanation for how they came to these things, right? So the text can be more helpful. Yeah.
Yeah, and adding to the result that I found, we basically, this is altruism, basically, if altruism is nurture or nature, because there's some debate if altruism is something real. But according to the results, even though I don't know too much about what they're measuring, apparently there's no like a normal distribution, which means that it would be like so significant about some between two different chemical components that it's in our brain naturally. However, there are some components that are like more meaning. They're more significant because it means sports are a little bit higher compared to the other two.
Okay. So are they saying, and this is not I've never studied this, so that's why I'm asking a clarifying question. Are they saying it is more genetic or it is more environmental?
They're saying basically there's a genetic component, but the results said like how to say it, not all the genetic components show significant results because they were compared different genetic components in this kind of situation.
Cool, cool. And you also mentioned a normal distribution. Does everyone know what a normal distribution looks like? Yes. What? Yeah. Yeah, like a mountain, right? So if you like randomly sampled, I'm so sorry, there's mathematicians here. I haven't taken math in so many years. But if you randomly sampled for a factor, often you get a normal distribution because it's like, well, for example, if you ask people like, you know, like, how are you feeling today? I feel like today might not be the best day to ask people that, but in general, like they might go from a scale of like 1 to 10, and it might be a normal distribution. That could be a very bad, there's so many environmental factors, so I'm just like, the mathematicians are gonna hate me, but that, you know, that is kind of what happens. So with a gene, you have genes that are like always off, always on, you have genes that are upregulated by different secondary factors, all sorts of stuff. So it seems like you're connecting the dots between what they're showing you in the data they collected and how they're coming to their conclusions, which I think is great. Okay, so also anyone, you know, don't forget to get your prizes. Let's move on. Okay, so we're at the almost to the end. So the discussion, and this is one of my favorite cartoons about data analysis and one of my favorite things about data analysis. You could also say it's my least favorite thing about data analysis. So let's start with the cartoon somewhere there. So remember I was like, let's start with the axes? Well, let's start with the axes. So this is number of husbands going up. Time seems to be on the x-axis. This point was yesterday. This point is today. I get the feeling she just got married. She's in a wedding dress. So she went from 0 to 1 over a period of 1 day. And as you can see, over the next month, you'll have over 4 dozen husbands. Better get a bulk rate on the wedding cake. You don't want to run out of the cake at the wedding. So yeah, that is actually a very accurate interpretation of this trend if you're looking at these 2 data points, right? You sampled, you took 2 data points, you made the graph, you mathematically modeled the trend, and then you extended it to show what the future holds using that model. It just happens to be very false. But nothing here, to be honest, was bad science, except for the fact that they didn't, you know, have an N that was large enough, not enough samples. They didn't put it into context of, you know, what we know about like socio and cultural factors and all of that. But if you ever want to have a weird afternoon, read a research paper from like the 50s. We were doing research back then. We just had a much poorer idea of the scope of a lot of things. And also those papers are like 2.5 pages long because apparently that's all you needed to get a PhD in the 50s. And yeah, it kind of reads like this sometimes. And somehow that took us to where we are today. Yeah, go ahead.
You know what the alt text for that comic is?
No, what is it?
By the 3rd trimester, there will be hundreds of babies inside you.
What?
Yeah. If you hover the mouse over them, it pops up an alt text. Alt text.
Does AI write that? Because I didn't.
No, no. The author does.
Oh gosh.
Not always, but most of the time. He adds an alt text.
Interesting. I mean, that's another trend that he is calculating. Okay, so you know, when you're looking at your graphs, we're all like, I think all these papers are more recent than the 50s.
Excuse me.
You know, wear gloves in the lab and all that sort of stuff. So hopefully they're not like this, but just remember this is a possibility and why you should trust your own interpretations. If you think something's weird in their data analysis, bring it up, talk to people, talk to you know, other students, other scientists, talk to mentors, faculty. Those are the comments that are, you know, it's really anxiety inducing, especially like for me, I don't know about for you, maybe none of you have anxiety, but to think, oh, I don't understand this and this looks weird, I'll never ever tell a soul in my life is my conclusion. But if you're the student in class who says like, oh, like actually, you know, the data looks weird, did you consider this factor? That's really insightful. So trust yourself, trust your gut and your scientific thinking, and maybe you're wrong, but it's an interesting conversation. So now we're at the discussion section. We're hoping they're not doing this with their data. So the discussion presents the author's own interpretation. You always have to remember it's their own. Identifies any unclear or unexpected findings. Sometimes they don't do that. They just like move right on. But usually they do say like, well, this is weird. We don't know what it means. Relates the results back to the gap in the field. And I think I've said it like 22 times maybe already, and it hasn't been an hour. But we do need to always put it in context. If we don't, we end up like this with four husbands, and just make sure we're relating everything back to their model. So going forward, the exercise, which we're not actually going to do, we're just going to like look at it, is identify how your interpretations align with the authors. Did you learn the same thing that they did from the data? Determine what gaps remain in the field. I'm so sorry, I said it one more time. But that's also, like, when it comes to proposing new studies and what we should learn and do in the future, that's really important. And then demonstrate your knowledge of the scientific problem by creating a simplistic yet comprehensive diagram of the model or pathway or theory. This and papers that I would rate an A+ on, which no one asks me to do, they do it for you. They, the last figure in the paper will be their model or their theory presented to you in a very digestible form. If you have the Cell paper, the first page has a graphical abstract, which is pretty much that. Cell is my favorite journal because of this, but often you have to do it yourself. And so that can kind of look like, these are two biology examples, like simplistic diagrams. I know these aren't the most simple, but if you start at one point, like, what happens first? In this case, it looks like this ligand, it's epidermal growth factor, binds to the receptor, phosphorylation, activates the MAP kinase, and there's like a lot of other stuff. But start, go step by step, don't get overwhelmed, figure out what they're saying and what they theorize is happening. They want to tell you what they think their brand new theory is. So, write it down, see if you understand it. And then I don't think it's in here. You can go back again, remember the order of reading. You can go back to the abstract and see if that makes sense now to you. You can go back to the introduction or anything, go back to the figures, see if they all fit into this theory that was presented to you and if it makes sense. Really quickly, citations demonstrate the things stated as facts. You can't, in a scientific paper, just state something as a fact unless it's been a fact for like, I don't know, was it like 50 to 100 years or something? Like, if you have to assume everyone in the field knows it. Like we know RNA and DNA, like DNA can be made into RNA. So you don't always have to say like, well, DNA is made into RNA. I don't know if you tell all my examples are biology because of my background, but for most things they have to cite, which is why the citations are like half of the pages that I gave you are citations, and why the introduction itself will have 1 million citations. So what you should do with the citations, and I actually failed to do this when I was a student, and it really kind of put me back. I just would skip the citations. I was like, great, I'm done. I've read the conclusions, like it's over. But you should find papers in this list that fill in remaining gaps. Sorry, I gotta say gaps. And knowledge that lead to new avenues of learning for yourself or for other people. So maybe you have unanswered questions. Maybe again, you need more background knowledge. Maybe this led you to think of like, well, I understand this, but is it related to this other thing I studied once? Go search for that. Go look at the titles and the citations. Do all that. Other sections, sometimes you see limitations where they're like, well, we can't do this. We can't have every single person in a country fill out a survey. Like you're never going to get 100% of survey response from people. You got like 25, maybe 50% of people will fill it out. I keep getting mail from like the NIH asking me to join a health survey, and it pays $5, so I throw it out. So that's a limitation. Declaration of interests, conflicts of interest. Sometimes people will be like working for a company that studies what they study academically, and like there's a lot of money and stuff, so they put it there. Acknowledgements, if you send somebody something, but you didn't do the research, like maybe you share a piece of DNA with them that helps them do their research. Like you're not gonna be the first author, but you might be in the acknowledgements. Supplemental information. Again, this is like really high level learning when you get into supplemental information, because that's where there's often really interesting results that they didn't have time to discuss, but you as a scientist who's not them could look into it, see if you want to study it, if you have more questions about it. These are often online. And if you have access to the article, you have access to these. They're usually not in print, so you have to actually go online to get. Okay, last slide, I think. So I couldn't, sit here and talk to you about how to read a research paper.
Can you guys hear us?
Yeah, hello.
Yes, we can't see you. I texted in the chat as well. It's been a while since we can't see you. So I can see the slides as well.
Oh, the slides are up.
Sorry to cut you off.
Can you see the? Oh no, it's
The camera was working before, but now it's not. So
It looks like the camera's frozen. I don't know how to fix that. Will exit the Zoom. Okay, I'll exit and come back.
Exit the
Yeah,
meeting?
come back, you know, we're gonna stop the Zoom and then please come back, we're gonna come back to Zoom.
Should I stop it for everyone? Or do you want to use Zoom? Is it okay if I wrap up here or do they? So we're gonna wrap up.